All right. Hi, everybody. This is the Cultivating Kindness webinar. Today's May 9th, 2023. I am Kelsey Lafayette. I am one of the content managers here on the nursing team. I am located in Iowa, currently in Philadelphia, and I'm joined by my lovely colleague, Paige.
Thanks, Kelsey. My name is Paige Randall. I am living in Raleigh, North Carolina currently. I work as a script editor on our amazing videos for Osmosis, and I've worked at Osmosis for about 2 years, and I'm doing my PhD currently in nursing.
Yay. All right, so we are going to start off here with what is kindness. So it's not a personality trait or a character trait like many people think. It's not something that is inherent to only some people. It's not something some people are born with and other people aren't born with. It is a virtue, which is basically a behavior tied to morality. So it involves being genuinely considerate and generous without the expectation that you're going to receive praise or award for those acts. So it can be physical, kindness can be physical, like a smile or a hug. It can be emotional, like providing words of encouragement. It can also be intellectual, like providing a learning opportunity to someone. For example, if you've ever been in a difficult situation in nursing school or med school and you saw a coworker maybe doing something that was out of their scope of practice, or they did something that could have harmed a patient. Being kind can also look like saying, hey, I noticed you were doing this. Can you tell me why you did it that way? Or, this is how it's supposed to be. So kindness can be a lot of different things. One of the big things surrounding kindness is that there's a lot of misconceptions about it. There is this conception that kindness involves a lack of boundaries, that it means people who are kind are just easily manipulated because they don't have boundaries, and others are taking advantage of their kindness. Kindness can look like staying silent in situations where you're expected to speak up, or that you're a pushover. All these things are misconceptions about kindness. And it's really important to understand what kindness is, what it isn't, and how you can incorporate it into your daily life and make it part of your culture. So that brings us to what is culture. If we want to have a kindness culture, we need to first understand what culture is. And culture is a group of behaviors or beliefs to a certain group of people, such as a group of coworkers that work on a certain inpatient unit, or a group of friends, or your family and your home unit. There's a lot of different cultures in the world. And why is culture important? Well, it's important because it provides social benefits. And that can include providing individuals with a sense of belonging. And at organizational level, it involves reflecting the mission, vision, and values of that organization. And so when we talk about kindness culture specifically, studies have been done a ton on kindness culture. And they show that in cultures where kindness is a daily practice, there are improved health outcomes in the workers and the patients. If it's a health organization, the patients have better health. The nurses and doctors have better health outcomes. There's less workplace stress. There's less burnout. The kindness culture can also influence the overall happiness of individuals, not just at work, but outside of work. So it improves their relationships, not with just their coworkers, but their family, their loved ones. And so that's really important because not only is that benefiting us psychosocially, but it can benefit us economically too, because if you have a culture of, say you have an inpatient unit of nurses and they practice kindness culture all the time, and it's just part of their daily lives, they are going to end up with less stress and burnout. They're going to have better communication with their coworkers. They're going to provide better care to their patients. Their patients are going to have better outcomes. And basically, you're going to help improve your small community, your population, by being kind to one another. So it's a very small step to having really great rewards. It basically just promotes a healthy environment to improve job satisfaction and lead to all these personal and institutional goals being met. Next slide, Paige.
Okay.
Perfect. Thank you.
I'm
next,
sorry.
One more. I was looking at my notes. Go back one. Okay, so as I said before, kindness is not inherent. It's not something that you're just born with and that, you're just a kind person. Some people, it seems that way. I definitely know some people that it just seems like kindness comes really easy to them, and other people where it seems like meanness is just comes to them very easily. But kindness is really something that needs to be active and purposely supported, developed, and recognized. It's something that everybody needs to work on day to day to make it become part of the culture. You can't really have a kindness culture if you just expect it to happen. It's something that you need to work on, and then everyone around you needs to work on it too. It needs to be a group effort. Okay, now I think I'm ready for the next slide, Paige. Over to
Okay,
you.
thank you. So Kelsey, that's a great segue into the next topic that we'll cover, which are barriers to kindness, and then also techniques and strategies you can practice yourself in order to cultivate a culture of kindness. So like Kelsey mentioned, it's not something that somebody is born with. It can be actually strengthened and nurtured over time, as long as you're practicing these techniques. So as we know, there are many barriers to kindness, not only in nursing, but in your day-to-day life. And some of the most common ones we came up with are being busy or feeling stressed out, feeling anger or frustration, which also can tie into being busy and feeling stressed out, but also being tired and exhausted. And just some other examples we added in were, distraction, fear, sadness, grief, anticipation, excitement even, and illness, things that can come in the way or act as a barrier to acting kindness and cultivating a culture of kindness. So I will share some more in depth in the upcoming slides, and then what to do when you face these barriers yourself. And Kelsey and I will try to share some personal stories from our nursing careers as well. But if you want to share some examples where you have cultivated kindness in face of these barriers, feel free to share them in the chat as well, and we will talk about them at the end of the webinar. So showing kindness when you feel busy or stressed out, you're experiencing, a very busy day on the job. This is not rare in nursing. We have busy jobs every day in nursing. And even if you don't work in a typical inpatient clinical setting or you work somewhere else, it's always, a struggle to maintain your kindness when you are super stressed or busy with your patient workload or demands that your job is expecting of you. So the first thing you can do when you're feeling busy or stressed out, or you are experiencing a very busy day, is just recognize what you're feeling. So sometimes when you're busy or stressed out, it may feel differently. You might feel angry or frustrated or anxious or overwhelmed. And just realizing that maybe this is due to being busy or stressed out is something that's so important, just to recognize where that feeling's coming from. And to also recognize that it's okay to feel that way. You're human. You're not a super person. You are expected to feel that way and respond to it appropriately. So even if you recognize that you're having that feeling, what do you do next? And one way to kind of take care of this and make sure that you're not taking it out on other people is to take a minute, even just a few seconds, and regroup and, talk to yourself internally and just say, this is what I'm feeling because of X, Y, and Z. Once you take a minute to regroup, you may even need to ask for time, from the person you're interacting with, whether that be a staff member, another nurse, a physician, a patient, a family member. And you might just say, I'm very busy in this particular moment, or I'm feeling a little bit stressed out, and I want to make sure that I'm able to address your concern or your question or help you with whatever you need help with. But I just need a few minutes to take care of what I'm doing right now in order to best address this situation. So just taking some time and explaining why you need that time is so important, so that you're not just storming out of a situation without giving explanation. So showing kindness when you're feeling angry. Yes, please share,
I want
Kelsey.
to go back. I have a good example of showing kindness when you're stressed out. One of my friends, she's also a nurse. She's very level-headed, and not much really gets her stressed out. But there are times when she's got way too much going on with her own patients. And she had an experience where she had like 5 patients. One of them was a rapid response that turned into a code, and she had just been really busy with this patient and her other patients all day. And this other nurse that had less patients and had just been kind of not helpful to anybody, including her own patients, all day, had kept asking my friend to do tasks for her patients. So basically, my friend is rapid responsing her own patient. This other nurse is asking her to do other stuff. And she just took a step back. She was like, listen, I have, this full load of patients. I'm really stressed out. I'm really backed up on charting. I need you to ask somebody else. Like, I cannot help you today. If you need help, you need to ask somebody else. And she just, explained, I don't, she identified that I can't do this. You need to find someone else. And, that kind of set a boundary, while still remaining kind, said, I hear that you need help. I cannot provide that for you. So being able to say that you can or cannot provide something to someone is also being kind.
Yeah, I totally agree. That's a great example, Kelsey, because you have to take care of yourself first. And it's okay to say that you don't have the bandwidth to help somebody out with something in that moment and to give them other resources to look into. And that's totally fine, even though if it feels, uncomfortable in the moment or it's hard to say no. Like I know myself, I am really bad at saying no. And sometimes you just have to for your mental health and to be able to cultivate kindness. So the next barrier to kindness that ties right into all of these being busy or stressed out is feeling angry or frustrated, because we know that when we're really busy or stressed out, it can sometimes cause us to feel angry or frustrated. And it's okay to feel this way. I know personally, when I feel overwhelmed or really I have a lot of stuff on my plate, I tend to lash out at others, even though they have literally nothing to do with it. And that's not just, in my experience as a nurse, but my husband would attest to that. So, sometimes it's just human nature to lash out, even if you don't mean it, and even if they don't have anything to do with it. So it's important to realize that that's something that's natural. And you may not be able to control how you feel in that moment, but you can control how you respond to others and how you bring them into the situation. So some strategies you can use when you're feeling angry or frustrated is first, try your best not to respond quickly or rashly out of anger or frustration. And that's, may feel natural and may feel like the first thing that you want to do, but sometimes it's not the best way. So try to refrain, excuse me, from responding quickly and out of anger and kind of, being nasty to somebody else, even if you don't mean to. This will only lead to hurt feelings, and then it'll make you feel bad in the long run, right? Because you'll think about it later on. Instead, just like we did when we are busy or stressed out, you want to pause and reflect. If I lash out at my coworker or lash out at a patient or a staff member, is this going to make the situation better or worse? Probably 9 times out of 10, it'll make it worse. So just take a minute and try to instead put on your lens of empathy. And what we mean by that is try to put yourself in their shoes. So, there might be a situation where somebody upsets you or makes you frustrated, or, the situation upsets you. But you never know what's going on in somebody else's life. And even if they're saying something that is upsetting you or making you, frustrated, the saying that my mom would always say is kill them with kindness. Try to look at that situation at, you have a lot of things going on in your life they don't know about, and maybe you have no idea what's going on in their life. So there might be other aspects at play that need to be considered as well. Okay, so the next barrier to showing kindness is when feeling tired or exhausted, which as a nurse, you will feel tired and exhausted, especially with your long shifts or your hours or the schedule that you have. You might be rotating days and nights, you might be working 12 hours. And not only that, but you have an entire life outside of nursing. You have a family and friends and pets and things to take care of. You might be in school as well. So feeling tired or exhausted is totally okay to feel that way. And this is normal and everybody feels it. So just like we said with, when you're busy or angry, you want to acknowledge how you're feeling, because sometimes you may act in a way because you don't really understand why you feel a certain way. So just acknowledging what's going on in your life and trying to kind of attribute that feeling to something that's tangible. So instead of putting a Band-Aid on it, we want to go to the root of our problem. So if we're feeling tired or exhausted, this would be a really good time to think of what are some ways that I can maybe mitigate this feeling. So it might be through self-care, like, taking a day off work, working out, sleeping, watching TV, even just taking a walk around the block. Self-care is never selfish. And you won't be able to cultivate a culture of kindness or be able to be your best self unless you take care of yourself first. So if you take the time to step away and take care of yourself, you'll be more apt to be kind in your future interactions with others. And you'll also be, invigorated for more of your work as a nurse and the stuff that you have ahead on your plate. So
Those are
denying how
all.
you're, oh,
Got another example and an ambulance behind me.
gotcha. Please share.
Going back to, I guess I always struggled most with showing kindness when I was frustrated and when I was exhausted, because a lot of times those two went together for me. And I can definitely say that I have been less than kind in my career. And looking back, I'm kind of embarrassed by it, because I think I could have chosen to react a different way, and it may have been less embarrassing now if I had been kind in certain situations. One really good example was I was coming on shift and I was getting a report from the offgoing nurse on this patient that he had a history of an MI and congestive heart failure, and he was getting a blood transfusion because he had had a GI bleed. And I noticed his blood was running in wide open, like running in as fast as it can go. And I was like, oh, wow, like you're running this in really fast for someone that has had a heart attack and has congestive heart failure. What's going on there, And she was just like, oh yeah, that's just how fast I put it, just kind of clueless that there was an association with a cardiac patient, especially one with CHF, and getting a large volume of fluid, blood products, no less, very quickly. And so instead of stopping and educating that nurse and asking if there was a reason why, I just got very frustrated. I was very short with her and I was like, that's fine, you can go. Just kind of wrote her off. And then I went and dealt with the patient and changed the rate of the infusion and everything. And I look back and there were a lot of times that I did that. And I think I could have spent that time educating people, making sure that they understood like the thing that frustrated me, why it frustrated me, rather than just reacting to that frustration. So it's definitely okay if there are times where you feel like you want to be unkind. Like everybody has it. Like, oh my God, I'm so tired. I'm so sick of this. Like, I've already explained this to this person this many times. Like, it's okay to have those feelings, but try to react in a positive way that's going to improve your culture, because being short with somebody and not explaining things isn't going to help anybody. It's also not going to help your patient, because maybe if I would have explained that to her, maybe it would have helped a patient down the line who had CHF and she was giving blood to next time. So something to think about.
Yeah, that's a great example. And I'm sure that people who are on the webinar and other nurses in your life have, been on the receiving end and been on the, on Kelsey's end too, where you are frustrated and exhausted and you just you feel like you don't have a second to be kind. So when you are approaching unkindness in somebody else, so in the last couple slides, we talked about kind of what to do on your end when you're feeling that way. But what do you do when you approach unkindness in a colleague or a patient or a family member, or even in your personal life? So these strategies are very similar to the strategies that you would use when you're feeling those ways personally. And we'll go over them individually here. So like we mentioned before, sometimes feeling like you don't want to respond in kindness is the natural response, and you can't help how you feel in the moment automatically. It's not something that you're thinking of and how you want your body to react. It just happens. But you can cultivate your kind responses to that reaction. And healthcare is a stressful environment for everybody involved, not just staff, but patients and their families. This might be the worst day of their entire life. So that might cause somebody to act out in an unkind way, even if they don't really want to, or they don't normally do that. It's a very unnatural situation to be in, being in the hospital or being under healthcare. So before responding, just like we mentioned before, you want to pause and acknowledge how you feel in the moment when you are getting this unkindness from somebody else. So how does it make you feel? Then you want to carefully craft your response with kindness, even if it's unnatural, even if your initial response is like, I need to fight back. Try your best to avoid this, because it normally is not going to lead to anything better by responding with unkindness as well. And you really don't want to escalate a situation that's already hostile. And you want to recognize that this person is likely struggling, whether it's something that they're struggling with, or maybe it's something that is hidden and behind the scenes that you don't know about. Recognize that something else is going on and it's not just attributed to you. And it can feel, if somebody's being unkind, it can feel very personal, and it feels like, what's wrong with me? Like, I need to defend myself. But sometimes when somebody's unkind, it has nothing to do with you, even if it's hard to, remember that and acknowledge it. You just never know what's going on in someone's life. So lastly, if the situation escalates or becomes hostile, so maybe you respond with kindness or compassion and that person is just continuing to escalate in their anger or hostility, it's totally okay to just remove yourself from that situation and to make sure that you are safe and that your patient is safe at all times. So that may be the last part of the situation, is just to remove yourself if you're unable to mitigate it. Okay, so we're kind of wrapping up to the end of our webinar here. We have some time for questions, unless Kelsey has any more examples that she'd like to share. I like listening to them, they're helpful.
Okay, yeah. So first, I'd love to prompt you guys with, have you had any situations that where you showed kindness to someone, or where you were shown kindness, or it could be the other way, like a situation where you were unkind and looking back, you could have handled it a different way. If you want to throw in the chat any stories about being kind, being unkind, or having either of those things done to you. I know, especially in nursing, if there's any nursing students, it's kind of a nurses eat their young culture, which is it's a huge problem in nursing, is that pretty much every nursing student has run into the rough and tumble preceptor, or the new nurse always gets the shaft every time. If you have any stories, throw them in the chat. But yeah, thank you for coming. If you have any questions, throw them in the chat.
Okay, Kelsey, I have a question, if there's not one in the chat or in the doc.
Mhm.
So I guess, oh, I'm sorry.
Oh, we've got one from Miss Karen, who, it's not so much a question, but I think it's important to talk about this. As a CNA, I find it so disrespectful when we are talked down to from the doctor or the nurse. And holy cow, yes, because CNAs are the backbone of the healthcare profession. I've worked with so many CNAs that I trust their judgment so much. They've saved me a million times over. And it's so hard because so many doctors, nurses, anybody that kind of thinks they're above a CNA based on what type of degree they have. It happens so much, and it's so difficult to deal with. And I used to be an ER nurse, and there was this one ER physician that he was just the worst. He was truly the worst. He was really smart, but he was just rude all the time. And I had this really sick patient that was like ready to die. Like I was, hanging stuff and doing, and I was like, I really need you to come see this patient because he's dying. And I had asked him multiple times. And finally I went back like a third or fourth time. I was like, you need to come see this patient. He put his hand in my face and said he didn't have time for me. And I was just like, wow, I can't believe this happens. And it's so difficult to, what do you deal with that? We should all be a team and we should all have the patient's best interest in mind. So when you see things like that happen, you really just have to, like Paige said, remove yourself from the situation. I obviously wasn't going to get through to him at that point. So I was like, I will just go find the nurse practitioner and have them take care of this, wait for the next MD to come on, because this is, this is not a good situation. And then I did not, I obviously didn't put my hand back in his face because that would have been unkind as well. So yeah, just remembering to treat everybody with kindness, even if they're not being kind to you, because it gets such a bad cycle of like, if the doctor's mean to the nurse and then the nurse is mean to the CNA, then, it's a terrible cycle. So yeah, thanks for bringing up, Karen. I'm sorry you're getting talked down to. I hope things start to change, but I'm sure you're a great CNA because I've met a lot of amazing ones. But did you have a question, Paige? I think I cut you off.
Oh yeah. Well, it's more of like it's not really like a question directed towards you. It's kind of like directed towards the collective we, but it's like when you come into contact with somebody who just like consistently is, unkind to you, like you can't, somebody you have to work with, and, you can't remove yourself from the situation because you're going to continue to see them. Like, what's the best case scenario or strategy to speak with them or work with them when it's somebody who's consistently acting in this way over time?
That's a good thing. I with that ER doctor, it was kind of a constant like disrespect to a lot of the nurses. Not so much the other ER physicians, but a lot of the nurses, any nurse that kind of, I don't want to say challenged, but any nurse that questioned things, even if they were questioning it out of like concern for the patient's well-being, he was very offended. And so it was really just a matter of, okay, well, if he's not going to address my concerns, who's going to address my concerns? And it was the nurse practitioner who's also on, or the other ER physician that's coming on is going to address them, because I'm not going to put my license or my patient on the line if I have a concern. And you can always ask them. One of the big things is sometimes physicians or even PAs, NPs, they can be unkind too. You'll bring up a concern and they'll be like, it's not a concern, don't worry about it. It's okay to say like, can you explain to me like why? Because there are different levels of education and they may have gone to more school, and so you can always trust your gut. You should always bring up, like, if you have one of those like gut concerns about your patient, bring it up, and then if they're not concerned about it, ask them to explain why they're not concerned about it. Like, that's fine. Like, please teach me why, so I know why you're not, like, why this is not an issue. And that can kind of help bring the team together.
Yeah, that's a great example. And I think even just giving that knowledge to somebody else, like we mentioned earlier in the slides, like respond and explain yourself. So if you need to step away for a second, or maybe you are really busy with something or unconcerned about something and somebody else is, like, it's just so important to kind of let that other person know what you're thinking, because they're not a mind reader and they don't know what you're thinking, what's going on in your head. So important, I think, just to communicate openly and effectively and not assume anything. And that way you can maybe change your perception of others or how you are perceived by them.
Yeah, definitely. And it looks like Karen has another question. At what point do we elevate unkindness to a hostile work environment to the department administration? Do you want to take that, Page? I have some thoughts on it, but if you
Sure.
want to.
Yeah. So I wish I had a hard and fast black and white response for that. I think it definitely depends on the situation and everybody's kind of what word am I looking for? Their breaking point, or like the point where they perceive something as unmanageable, is different for every person. So I think if you are ever feeling like the unkindness or the relationship between you and another person is impeding patient safety or impeding, your psychological, physical, mental well-being, that's something that needs to be escalated. I know one thing in particular that my nurse manager would always say was, did you talk to the other person about this? Because sometimes it can, even escalate the situation more if you go and talk to your manager and then, you've never actually talked to this person about how you feel. And it might be uncomfortable, or it might be, something out of your comfort zone, but that person might not know how they are coming off. And that's just their personality. And even just to say, could you explain to me why you're saying that? Or, when you say X, Y, and Z, it makes me feel this way. And to really humanize yourself and humanize them. And if that still is not working for you to one-on-one speak with them, then I think it's, you should escalate the situation through whatever route is appropriate in your clinical setting.
I agree. That's perfect. I had a nurse manager that was, her first question was always like, did you go talk to them? And she always made us like, I feel statement, which sound kind of silly, but she's like, you need to use an I feel statement. Like, I feel terrible when you're yelling at me in front of the patient. Like,
yeah, it's like you're at your
using
little
I feel
Mad
statements.
Libs.
Yeah, exactly. But yeah, and then sometimes I know there are some less than fabulous like HR departments in some places where like you can repeatedly kind of be like, hey, this is a really hostile work environment. Like this one person is really just bringing down the culture. And nothing really seems to happen sometimes. Like everybody's short staffed and, things, it's, it's a body, someone to work. So a lot of institutions will have like, I don't think it's called an incident report, but it's kind of an unusual occurrence where you can actually fill those out for like coworker to coworker like behaviors that are inappropriate. You can fill those out and they go to kind of like the board and like all the head honchos of these organizations that look at that. And so that's kind of like the next step. If like you're not getting anywhere with HR and you're still in a really terrible culture and environment, you can escalate it more. You can also like leave that organization if it's bad enough, which is a whole other webinar, but like just remember that if you're working in a culture that like just keeps perpetuating unkindness and you just feel terrible every time you're there, like you don't have to have a loyalty to an organization because they're going to replace you. Every organization is like that. So if you're just in a terrible environment and you've done your due diligence to do what you can, then maybe that's just not the organization. That's not the culture for you. You need to peace out. That's okay too. So yeah.
True. And that, everybody is different. And just like Kelsey talked about earlier, everybody's culture is different and everybody's personality is different. So there might be people who thrive in that environment and it might just not jive with your personality or how you enjoy working or caring for patients. And that's totally fine too. Everyone has somewhere they fit in better.
Thank you everyone for joining so much.
Yeah, thank you.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more